That was an example of if I externally rotated. So now if I take an x-ray and I internally rotated my knee, now look what happened. It not only made it smaller from one direction, but look, you could even see it kind of like translated my knee towards the lateral aspect, towards the right. So that is definitely something. I mean, if you had an x-ray of that as your knee, that would be scary to an orthopedic. Wow, you need to really think about what you're going to do with this, because it looks like this lateral aspect right there is bone on bone. But is that bone on bone? No, because it's the same knee as this. It's just internally rotated.
Distortion by x-rays.
Exactly. Then I said, okay, well, what happens if I take my knee and I bring it in like a bow, like a bowing of the knee? That's called geno valgus. Well, now that's even way worse, right? And we see a lot of people coming in like that, but it's not because of the knee. It could be because they flatten the arch of their foot, or maybe their pelvis is off where they rotate their spine or their pelvis to the left, and it causes their right knee to come inward. So that could be a structural thing. But look at the knee itself. It looks horrendous, right? It looks like these bones are rubbing together, and then this space looks pretty good. So that's your geno valgus, your knee in posture.
Do you know that 33% of knee replacements are failures?
I mean,
33%, that's a high number. And most of that is because the joint was fine, but it was a nerve issue or inflammation within that nerve. All right, great. Keep going. Let me see the next.
And then this one is my neutral knee compared to bringing my knee outward now, like bowing outward, right? So that could be that maybe you have an increased arch in your foot, or your pelvis is, shorter on one side versus the other, and it's causing you to put more stress on that outside of the knee. So look what happened there. Now it's the opposite. So if my knee bows outward, the inner joint is going to look more degenerated. If my knee bows inward, the outside of the joint is going to look more degenerated. But again, once again, same knee, same person. All these x-rays were taken literally seconds apart. So it was done neutral, external rotation, internal rotation, knee in, knee out. Took me 10 minutes with my business partner to do all this. And we're able to show you how projection of an x-ray could make a joint look a certain way. So this is like super powerful to understand, not only just for the soft plate therapy, just to understand x-ray imaging, and when you see an x-ray of a spine, or you see an x-ray of a knee, you have to think not just what do I see there, it's like what movements could create that.
Posture dictates function. That's something we've always talked about in chiropractic biophysics.